So leak rates vary by centers. If you take a look at the most recent trial that compared bowel prep or no bowel prep after surgery, you have a risk of 12 to 15%, which seems a little high. This is in Europe. Without bowel prep versus with prep goes down around half that. At big centers of excellence, you're probably around 3 to 5%. But that also varies depending on what part of the colon or rectum you are cutting and resecting. What I will actually submit is that there's an array of, I think, associated post-surgical issues that I think are linked back to the microbiome. I would argue not only anastomotic leaks, but there's a big risk of ileus after surgery. That's somewhere between 10 and 30%. Ileus is where you don't have a bowel obstruction, but your bowel has gone deathly to sleep. It stops peristalsing and it's stuck. It just ain't working. It's functionally stopped for a little while. That is a major problem. Actually, that's one of the leading causes for delayed discharge after seemingly a technically perfect operation, but also the surgical site infections as well. So I think overall, while leak rates remain as low as we can get them with all the technology, and I don't know how much smaller we can make the darn robot doing these things, there's that myriad that I think is underlying the biology that we just are not doing, in my opinion, enough about to optimize outcomes after surgery.